My name is Dr. Mark Fisher. I'm a board-certified plastic surgeon. As we age, the facial tissues tend to descend, and a facelift, the goal is to restore those tissues and lift them back up to where they belong. But as we age, we also lose volume in our faces. So very, very often, I will combine a facelift with fat grafting to restore volume to the face. My goal is to really achieve facial harmony and to think of it in terms of facial rejuvenation and not as any one procedure at a time. I spend a lot of time talking with my patients about what procedures we need to combine or choose from to really achieve their goal of facial rejuvenation.
My name is Belle, and I had a facelift, a neck lift, and fat grafting. The motivation behind this procedure was that I feel really youthful, and I teach an exercise class, and I feel great inside. And I started to look in the mirror, and over time, I felt older, and I wanted the outside to reflect the inside. And then that's really what set it for me when I met Dr. Fisher in person, and I looked at his resume, his experience, his testimonials, and that was really important to me, and I felt very comfortable.
The amount of time needed for a facelift can vary depending on what procedures we combine. Whereas a facelift by itself can take anywhere between 3 and 4 hours, a facelift with fat grafting or with a lip lift or with a blepharoplasty can take anywhere from 4 to 5.5 hours.
The day of the surgery, he sat with me and literally held my hand and reassured me. And his bedside manner was terrific, and that was most important for me.
What I tell my patients is after that initial 2 to 3 week downtime recovery time, you're really gonna start seeing the final results at about the 1 to 2 month point.
I just feel great, looking in the mirror. I love who I see, and it reminds me so much of the girl that I saw that was in her 20s or 30s. And I feel really good about how I look for 57, and I feel great about moving forward. And if I need any touch-ups at any point, I am all for it, and I'll be calling him up.
My recommendation to patients who are thinking about a facelift is to come in and have a conversation with me and tell me what your goals are and what you're looking to achieve. And then together we can come up with a plan to really meet your goals. And sometimes that may be a facelift, sometimes that may be a facelift with other procedures, or sometimes that may be other procedures. But having that open conversation about your goals, I think is the best way to achieve the results that you're looking for.